AHI, for bringing you our monthly healthcare reform updates. I was looking back on our recordings and how long we've been doing this. So it's been over a year and a half, every second Friday of the month. Now today's Thursday. I had a conflict. I'm doing a CEC presentation tomorrow on behalf of NAFA. So I had to move this event to today, but we've gone all the way back to like May of 2013, I think, since we started these. So thank you for your support and for hanging in here with me. It's been, looking back, right, it's been just kind of a wild ride. And here we are in the thick of it. So let's get going on this morning's healthcare reform updates for agents. And I looked through several things that we're going to touch on today. And just as a reminder, we do record these. They're posted out on our website. We have a YouTube channel, and so you'll be able to listen or look back on these slides and this conversation if you need to at any time. So my role is really to bring to you the highlights of what's happened since we talked the last month. And so we'll go through, and you'll see the list of things on our agenda this morning. And you know what? It's so funny. I talk to you guys day in and day out, and I still find agents who aren't clear about the timelines. So we're going to just review that again. That's a repeat, I think, from the last 2 months, but we're going to do it again. Just review the district court decision, two decisions that happened since our last conversation. Updates on ACA reporting, some affordability guidelines for employers already rolled out for 2015. Just an update on the contraceptive coverage issue. And just another little note, I don't know how many of you have employer groups with employees in other U.S. territories, but just I saw a quick update on that. I thought I'd throw that in here. And then we'll end with fall training and then any other questions that you have. So we have a pretty full agenda today. I start with this because this is what kind of started to throw the wrench into everything, right? And I don't have a separate slide on this, but this is where House Speaker Boehner has filed a lawsuit against the president stating that he has really overreached his executive powers really because of this right here, because of if you like your health plan, if you can keep it, because he has pushed out these dates for when this employer shared responsibility should have kicked in, as well as really the when all people must be on Affordable Care Act plans. So that's really what it's about. As you know, the individual mandate moved forward. All Americans are supposed to have health insurance or pay a penalty. So that's still in place, but this whole concept of moving to Affordable Care Act plans, of course, individuals are allowed to keep their non-Affordable Care Act plans until January 1 of 2016. So as it is our duty, obviously, when we work in the individual market to make sure that we are shopping, though, every year for our folks to find out if their rate increase that they're going to get on their non-ACA plan is still cheaper than what they can get with new ACA plans. So that's an interesting one. Of course, we don't have 2015 rates yet for anyone. In fact, I was talking to one of the carriers, and they go through this process every year of filing their rate increases with the insurance division, and for those that play on the marketplace, going back and forth with CMS at a federal level. So I'm hearing we're not going to see rates until later this fall. It's going to be the October-November timeframe when we're finally going to see some rates, and probably into November, which, as you all know, just wreaks havoc on what if you all play in all three markets, and we support you in all three markets, the under 65, over 65, and group market, yeah, this is a challenging time. So just know that we know that things are going to all come together, and in November will probably be the heat of everything going on in November. So that's when we'll start to see some new rates for 2015. But let's face it, rates probably aren't going down, right? So it's all a matter of how much each product is getting rate increased. Now on the groups, 51 to 99, remember they got a special allowance, if you will, to delay ACA compliance. Now we've moved to the employer group space, so they really have until October 1st of 2016. Now as you can tell, they've pushed it out because of the renewals of these groups. So as groups renew, If they have a January 1 renewal, then they may go ahead and go to the new ACA plans if they're not yet, sometime on January 1, perhaps of 2016, or February 1, et cetera. But all groups 51 to 99 that are non-ACA must move into ACA compliance by October 1st of 2016 or pay the penalty. And then the groups 100 plus, they've been, the only real allowance that they've given or leeway they've been given is that they've reduced the number of full-time employees that they must offer coverage to 70%. It was 95%, so they've pushed that out another year. So, but just suffice it to say, groups 100 plus must offer a 60% actuarial value plan and meet the affordability guidelines by January 1 of 2015. So that's where I think a lot of rallying is around right now, these larger groups. I know of, and I don't know if the agent's on the call, but an agent meeting I went with an agent to where there's a warehouse, or excuse me, a manufacturing facility and a management or an office facility. They only had 10 people on their group, but they had 100 people out in the factory that they were not offering health care coverage to. So there are still those groups out there that they are going to be considered over 100, right? And so they're going to need to comply by January 1, and they still need help. So hopefully if you've got groups of your own that you're dealing with, you let them know there is no pass for them. When they're defined as 100 plus, they must meet the actuarial value and affordability guidelines and offer coverage to at least 70% of those full-time employees by January 1 of this coming year. All right, so sorry to beat the dead horse, but I think just to be clear again, we can't almost say that enough so that we're coaching our customers right. So let's talk about what happened in the courts. This was just a couple weeks ago, actually, and it's interesting because there were two circuit court appeals that were going on at the same time. This one in D.C. Had a 2-to-1 ruling that said that the Affordable Care Act restricts subsidies to anything but those that are in state-based exchanges. And so what was interesting about that is that was they felt, the D.C. Circuit Court felt that was very clear, and that it is not part of PPACA, that in Iowa, for example, then technically we should not be getting any subsidy funds because we opted for a federally facilitated marketplace. So it's very clear, it appears in the law, that those subsidies are intended only for those states that take place in the state-based exchanges, not federally facilitated marketplaces. So let's go to the next slide, because this was what the Richmond Circuit Court said, that as a matter of fact, what they believe, and it was, I believe, unanimous, yeah, 3-0. So it tells you a little bit maybe about the makeup of certain courts, but in Richmond, Virginia, that appeals court, circuit court rather, said that no, their intent certainly was to allow anyone access to the subsidies, regardless if they're in a state-based exchange or a federally facilitated marketplace. So as you can tell on the bottom of the slide there, what it really says is we can expect this to go to the Supreme Court later this year. And so, nothing urgent now, but if you hear this from your clients, or that their subsidy, especially if you sold in the individual marketplace, and your clients are getting subsidies, if they've heard this, you can let them know, rest assured, this is going to take some time to work out. We'll stay tuned, and of course, I'll keep you guys posted. But yeah, so clearly we're not going to know anything until sometime probably next summer on a final ruling on this. But you can kind of see both sides. It's like you hear the pundits talk about it, and they said no, the law was very specific because they wanted to encourage states to get into the state-based exchanges and not ride the coattails of the federal government. So interesting here. So we'll see what plays out. But I want to make sure you had the detail on this in case you're asked. Interesting stuff. Another update here is around ACA reporting forms. Now, notice here where it says the IRS releases draft forms for the new reporting requirements. So it talks a little bit more here about all the things that the employers are going to have to provide to the government. And boy, I don't know about you guys, but I read through this stuff, and I'm just like, the burden that obviously this has put on the employers, incredible. So just know that that's out there. There's a nice, if you need any more information, by the way, from what we've talked about today, because I've got a lot more, I'm just trying to give you the high levels, and if you play in that market or you find something interesting, give a holler to our office. And by the way, it should be this week, we're sending out kind of an updated organizational chart, so you have a better idea. If you're kind of talking about group-related things, then here's our team of group folks. If you're looking for individual support, here's our team of individual folks. Now, if you just don't know who you want or what you want, just call anybody and ask, and we'll get you directed to the right group and get you your answer. But again, if you find anything here that you say, yep, I need more information on that, or I've got a case that's specific to that, or an individual, just give our office a call, and we can. There's more, like I said, behind this that I'm sharing with you today. What I wanted to show you here is on the next slide here, the 2015 affordability for employers. So remember when we talked about when a group that's over 50 that's talking about offering benefits, and remember there's the penalty if they offer benefits but they're not considered affordable. So it was always 9.5%. Well, you'll notice in 2015, and I'm sure it's due to inflation or the consumer price index or whatever index they use, it's now going to a 9.56%. So this needs to be calculated in. So when employer is calculating, is their plan affordable for 2015, we now know that it's not 9.5, it's 9.56% for those planned years beginning in 2015. So you're fine if you're doing your 12-1 renewals and you renew again for 12-1, you're fine, right? So it's, but any plans that begin in 2015 need to use this new affordability calculator. Okay, so I'll kind of leave it at that. But again, we've got more detail on that. And then this one is interesting. I'm moving into now the contraceptive coverage. So you guys have heard in the news, and now it's referred to as the Hobby Lobby situation, right, or the Hobby Lobby waiver, if you will. And so Hobby Lobby won the right for closely held for-profit corporations that do not believe, this violates their beliefs, that they do not have to offer the contraceptive services. And so what's interesting, and there's more lawsuits going on this, there's other companies that say, well, wait a minute, I'm a nonprofit, but I don't fall under the waiver that they granted many entities in the Catholic Church. Okay, that was one lawsuit that the Catholic Church won a waiver for. And then there's a whole list of things. There's some nonprofits right now. So see, this one that they just did for Hobby Lobby is a privately held for-profit company. Well, now there's more lawsuits going on about perhaps nonprofits that do not meet the guideline that the Catholic Church got. So there's more stuff going on here, but this one is specific to the Hobby Lobby case. So notice here that it says, especially if they want to, if you've got any clients that are talking to you about this, and you know your clients, you know those that are more faith-based and are concerned about this offering. So just know that there's some guidance here, and we've got more detail again behind this, but more guidance for those plans that want to reduce or eliminate contraceptive coverage sooner than later, right? They don't want to wait until their plan renews. They want to do it really mid-year. They want to do it sooner than later. So just know there's more conversation and more forms and guidance around that. So if that's applicable to you and you need more information, you let us know. So the next item, and I'll just say this to you guys, because of this format and because we have quite a few on the call, jot down your questions or comments, please, as we go through here. And then at the end, when I'm done with the presentation, then we'll open it up to Q&A and or your chat functions if you don't have a microphone on your computer. Otherwise, raise your hand, and I'll call on you and unmute your microphone to ask your question. So please jot your questions or comments down as we go. So this was maybe not important to all of you guys, but if that's one of those fluky things. So if you do have an employer group that has any folks that are in these territories, or you've actually got clients that have their groups that are here, there's certain Affordable Care Act guidelines that will not apply to individual or group health insurance plans in these U.S. territories like Puerto Rico, the Virgin Islands, Guam, American Samoa, and Northern Mariana Islands. So, and it's specifically around essential health benefits and guaranteed availability and medical loss ratio. So if you have anything like that comes up, just let us know. They do have some more specifics around there, and they're kind of loosening up the guidance, if you will, or guidelines, I should say, to some of those in those U.S. territories. I'll tell you guys, I don't know about you, but this thing just gets deeper and deeper. As I was putting this presentation together yesterday, a lot of times I'm just shaking my head. I'm sure you do the same thing. In a meeting I had with another agent yesterday, we were talking about, you know, the political environment and what's going on right now, and will this get repealed, and or will it be modified and certain things repealed and or changed or fixed. And you know, that analogy about, I like the one about the trains left the station. You know, we knew that one a year or two ago. Things have already started to happen, and some people like some of the things. But we're getting into all this business now with our employer groups, and we're down the road on this, and it is this burden on our employer groups who were fine doing their own thing, right? This is not what needed to be fixed, right? But with the toothpaste is out of the tube. You know, that one, and think of how messy that gets to try to put that back in. And so that analogy, we were kind of chuckling about that yesterday because that analogy probably fits. It's just a very, very messy out here right now, right? And you and I are faced with this. And at the same time, what we want to do is find the opportunity here because they need us now more than ever. So continue to find the opportunity. As much as we can muddle through this and we shake our heads, and we go, are you kidding me? Knowing that that this is cause for us to really step up and know our business and know how we can help our clients through this, because, as I said, they need us now more than ever. One of the other things that I want to make sure you're aware of, and I know you guys, and I apologize, we are bombarding you with emails. Not only are you getting them just because we're trying to keep you in the loop of what we're doing with our recruiting efforts to bring on other quality agents just like you guys to the KHI team, but we've got continuing ed events that we're putting on, additional training from the carriers, and I'll tell you, I'd rather over-communicate, though, than under. So if you see something, hopefully you read the subject line. If you're not interested, delete. But I'll tell you, if somebody calls me and says you guys are sending too many emails, all I'm going to say is then delete it, please, because we've got other people that need to see it. So we are going to over-communicate. I'd rather be guilty of that than not sending anything at all. And feel free to holler at me, or if you've got some other thoughts or ideas. We do try to be selective about what we send out, and we don't send you everything. And we try to host this, so I'm not sending emails out about everything I'm talking to you about today. So if you have any other ideas, you let me know. But regarding fall training, these are important. These are important because Co-Opportunity Health, Wellmark, and I don't have Coventry's dates yet, but they're all looking to offer classroom coverage. They'll offer some continuing ed, whether you need it or not. But it is a good opportunity to get face-to-face and eyeball-to-eyeball with our carriers. And so Co-Opportunity Health, I think as I mentioned before, I'm just going to review it again, that there's training sessions going to be going on pretty much in the October timeframe for Co-Opportunity. And what they're going to do is do sessions in Fort Dodge, Des Moines, and then probably somewhere over on the eastern side of the state for each of their 3 general agencies that are in Iowa. And as you know, Fort Dodge being our home base, they're going to offer a morning session. KHI has opted for the morning, so we'll try to drive most of our agents that want to come to a session that's sponsored with, by Co-Opportunity, but with KHI. We'll be having the morning session on October 8th. I believe it's at the Starlight. If you haven't seen it yet, you'll be seeing more information come out about that. But these are hosted by Co-Opportunity. They're setting these up. They'll do a morning, and then an afternoon session will be general. They'll do the same thing in Des Moines. They'll do the same thing over in eastern Iowa. So we're not saying you have to drive to Fort Dodge, but they're not offering us an opportunity to host any other meetings. So you'll see us if you want to see us and come to Fort Dodge. Otherwise, we will have our other representatives from KHI at these other training sessions. So you'll see some of us there. We'll try to hit all of them that we can, but just know that the one that we'll be hosting, if you can make it in Fort Dodge on October 8th, and right now off the top of my head I don't have the other dates for their other training sessions throughout the state, but we will send those out. It's a little early to send out the RSVPs yet for October, but I wanted you to know Co-Opportunity is in October. But Wellmark is probably first and foremost now. We sent out a hold the date email a little while back, and here, if we didn't send it yet, we'll be sending it very soon. I think it might have gone out yesterday. But now we've got our locations locked in for Wellmark training. And as you know, this is annual training. Every fall we do this with Wellmark. They are hosting the event. We'll do 2 sessions in Fort Dodge on the 8th and 9th. And these are really all-day sessions. They're like 9 to 4. So there's 6 continuing ed. The last hour of the day is ethics if you need it. If you don't, you can take off early. And of course, you're welcome to join us at any part of the training if you're not interested in all of the information. So things that are, I think it's on the email that we sent out, but things that we'll be covering are things like, what's happening with the prescription drug plans for next year. Any other updates in the individual market will be covered. Any new products, we know for sure they will not participate in the marketplace, but they will have new plans for 2015. So we want to know what that is. We think that, and we hear that they're coming out with also some kind of a skinny down network plan. So more to come on that, and that will happen along with some healthcare reform updates to really make sure that we've got enough continuing ed for the day, and then ending with an ethics. So it'll be a full day, and then of course Storm Lake on the 10th, and Des Moines on the 11th, Coralville then on the following Monday. And then we did get, because we've seen a lot of interest from agents that are selecting KHI as their new general agency over in eastern Iowa. We're really excited about expanding over there. So we did get Wellmark to commit to conducting a Waterloo session for us, if that's more convenient for some that are in that little bit more of the northeastern area, quadrant of Iowa. But we don't have a date on that yet. Our broker account manager that will conduct the training is on vacation this week. So we got her go last week before she left that, yes, we will conduct a Waterloo session for KHI and for our agents, but we don't have the date or location scheduled yet, and that'll be determined. And by the way, if anybody's on the phone from Dubuque, that's the other area that we're seeing some great interest in KHI. So we may even be able to open up and have a Dubuque location as well. But we won't know that really until September, so it's too late now to have a Dubuque Wellmark session. Waterloo is as close as we can get right now, but we are looking at expanding over even into Dubuque, but it really will depend. When we close out on September 2nd, when agents have selected their general agency, then we'll know where we need to be based on our agents. So anyway, if you have any other thoughts or ideas about locations you'd like to see us in that we're not in today based on where you're at, please let us know. We think we're covering the market pretty well, but you let us know. And then Colonial Life was gracious enough to say, hey, I've got some continuing ed. Now today is our deadline to find out if we've got enough interest, and then Joe Evans with Colonial Life is going to be traveling around to doing a Fort Dodge morning session on the 11th. This is 2 CECs, and then Des Moines in the afternoon, and then moving over to Cedar Rapids. And so anyway, we're going to know today whether or not we've got enough participation. So hopefully we've got, if you're interested, please get back to Sarah in our office if you're interested in one of those 3 sessions. And then we are looking at, I don't have it on here, but we did get some feedback from some folks in Sioux City and said, hey, what about us? Are you doing Sioux City or Storm Lake? And I was tickled to hear that actually, because we put this Colonial Life 2 CECs together quite quickly actually, and lined them up and thought, well, we'll do a Fort Dodge and maybe Des Moines. Well, then all of a sudden we said, well, why not Cedar Rapids? And now we're saying, well, why not Storm Lake or Sioux City? Would you forget about us? No, we haven't forgotten about you. But it looks like we'll put that class on for the Colonial Life and 2 more CECs in September. And that date will be coming out soon. So, yeah, so as you know, it's our commitment to make sure we provide you with enough continuing ed credits so you never get on that in that situation where you're trying to renew and you don't have enough credit. So we're committed to making sure that we take care of those for you. They're always complimentary when you get them through KHI as one of our agents. The other thing that I'm excited to announce is, and it kind of falls along with fall training, but I'm excited about these dates. And again, thanks to Marcy and Eric on our Health Underwriters Board and lining up our programs. But and as you guys know, I serve as membership chair, and I'll say it again, if you're not a member of Health Underwriters and you derive at least, the number I use is $25,000 or more a year in health insurance premiums, you can't afford not to be a member of NAHU. So you talk to me, please. We list bill it for you, so we take care of all of that, and then you can either have it deducted monthly out of your commission check. If you guys really, it ends up being about just over $1 a day, and it's like $375 for the year. So we're happy to take that out of your commission check, or you can write us a check, but we also secure you a discount by list billing it through KHI on your membership. It's only 3% now because I just needed 10 to do that, but I think once I get 20, I think it's 20 members, and we're darn close to that, I get a 5% discount, and then the discount keeps going up the more people that I get on our list bill. So please make sure, notice there's a break for you also. There's $30 if you're a member or $50 if you're a non-member. And the CEs I know have been applied for, so you can look forward to some additional continuing ed there. But anyway, let me know if you are interested in membership, please. And Misty handles that in our office because she handles your commissions, and it just makes sense. So let me know or let Misty know that you want to get on board with Health Underwriters. And then we're hosting, Health Underwriters then is hosting these dates, August 28th, September 16th, and September 18th. So look at your location that might be closest to you. The exciting thing here is all of the carriers will be here. Now, I left this off, this brief, but I've got the email, and we will be pushing that out to you. So you'll have these details via email, if not today, perhaps tomorrow. Again, not bombarding you with information, but I'll tell you what's valuable about these events that are coming up is all 4 of the major carriers will be there. Wellmark will be there, Coventry will be there, United Healthcare will be there, and Co-Opportunity Health will be there. And if you want an opportunity to get eyeball to eyeball with these carriers and talk to them about concerns, questions, issues, they're going to be talking to us about what's teed up for them, what they're seeing coming in 2015. So it's going to be a little bit of a sneak peek prior to, for sure, prior to Co-Opportunity's training, prior to Coventry's training. Now, some of us will have had the Wellmark training, but it'll just be interesting. And they're all there, and they're all in the room, and they all hear each other's comments and conversation and hear our questions back to them. So I can't encourage you enough to look at one of these dates and see if it works with your schedule, and make it a point. You can get online to the Iowa Health Underwriters website there down at the bottom of the slide. And again, if you have any questions at all on any of this, you can get a hold of one of our staff or give me a shout, or certainly get a hold of Marcy or Eric as well. So I think that kind of wraps us up. We're sitting out about 9:30, and I want to go ahead and open up hand raises and chat questions and just open it up for some dialogue with you guys. Looks like we've got quite a few of you on the phone today, so I'll kind of scroll through here. And then what I do, as you know, is I will unmute your microphone if you've raised your hand, and then please unmute your phone if you have that capability. If you don't have a microphone because you're doing it all through your computer, then please use the chat capability. You should see that down at the bottom of your screen. I'll make sure I'm going to look at the options here and make sure that yes, you can ask questions and you can raise your hand. So that is opened up. So let me scroll down through here. And let's see, Sue, I'm going to try, I see your hand is raised, Sue Murphy. I'm trying to unmute your mic, and it says, let's see. I think we just sent the audio pin to you, Sue. I don't really, I guess maybe there's a pin you want to put in there. I thought I controlled all this, but let's see. Okay, I'm not sure why I can't get to you, Sue. Sue, if you have a chance to open up the question session, ask a question. Let's see, it looks like I've got one here. So it says state law requires contraceptive coverage in Iowa, and the ruling in the courts didn't impact this Iowa law. So fully insured in Iowa is still required to cover contraceptives. I think one of the issues is one little difference there is that with the Affordable Care Act, they're supposed to be with no copay. In other words, right? Yes, Iowa law mandates an insurer to offer it, but not pay for it. And so, as you know, with the Affordable Care Act, what they've done is not only Iowa law does say that it must be offered, but yeah, and I see you say correct there. Thank you, Eric. So thank you for the clarification there. So really the issue kind of comes down around who's paying for it, right? And I think that's the issue with Hobby Lobby is, A, they didn't even want to offer it, and B, they certainly don't want to pay for it. Okay, let me look for some more questions or raised hands. Any other comments? And I apologize, Sue, for some reason I'm not able to unmute your microphone there. Okay, so here we go. Let me get some more of the questions here. So, reducing or eliminating contraceptive coverage is just an option for large groups, correct? And so that's exactly what we were just talking about, and then Eric had commented that state law does require contraceptive coverage to be offered by the insurance carriers, but again, not paid for. So Scott has another question or comment here. Wellmark December 1st renewals, do you anticipate the census information will be available on Q for quoting alternative carriers? That's a good question, and I'm going to jot that down, Scott, and we'll find out and get back to you. And it's great, too, because some of this stuff, we'll see if I can get some answers now, but these are also great questions if you can make it and come to those sessions when the carriers are there. This is some of the stuff that we definitely go through and uncover if we can, prior to training or during training. Let's see, and then Sue says, is anyone else having trouble logging into healthcare.gov? My password and username is not working from what I sent in last year. Well, remember, Sue, and call our team if you need to, but remember there are two different logins, and they make this so easy for us, don't they? There's the login actually to like the portal to do the training, right? And where you had to get confirmed that you are who you say you are and all that kind of stuff. And then there was a separate login. And so give a call into our staff, because I know right now we're going through all of that as well to get trained so that we go through it and we know how to help coach you guys through it. So give our team a call this morning, Sue, and just double check with passwords and logins and how to get through that most efficiently. And then I see a question here from Rick. Will the new rates for 2015 be available for Wellmark at the September 15th training, or just the new products only? Yeah, again, a good question, Rick. I think kind of like the other question there from Scott, that I know they're going to be releasing new products, and always, and I got this both from Wellmark and Co-Opportunity, always they wait on approval from the division. And so will they have approval from the division by the time we do training? And part of that was why we try to push out these meetings and do them as late as we can, but we don't want to go too late, because then we're just in the thick of it, and trying to pull you out of the field, out of the office rather, for a meeting just doesn't work. So we'll have to wait and see on that one, Rick, if we've got the rates. That'll be a great question, but so far we haven't heard anything, and I know we'll be the first to tell you as soon as we know that we've got rates and that they're available, and most likely then they'll be out on Q. Back to Scott's question. So Diane, I got your question here, and 9.5% going to 9.56%. Any update on whether this is employee income or household income? Well, remember, and it really is, when the law first came out, they talked about household income, and then remember when we all looked at each other and scratched our heads and said, how is an employer supposed to know what the household makes? And so they came back out with another safe harbor that says now you can go ahead and just use the employee's income. So that's been the direction that I've always given is to anybody that's at an employer group, is just use the employee's income to determine. And so that's what it is. So it's based on the employee's income and the employee-only coverage. So so yeah, that always they try to muddy the water there. And then and keep the questions firing, because I'm gonna keep scrolling through these, and if you have more comments, go through. I'll just read them through as they come in. So this one's from Brenda. So for large group employers renewing 4/1, when does the employer mandate apply? 1/1 of 2015 or 4/1 of 2015? So and that's for large groups, and that's a great question. So. Eric, I'm gonna see if, and maybe you're seeing these questions too, so let me hold that real quick, Brenda, because it's interesting when they say that the employer group mandate should be by 1/1 of 2015, but you're right. What if one of these large cases renews 4/1? Is it any time during 2015? And so I just want to I want to get confirmation on that as well. So I'm making a note on that, and maybe we'll have somebody pipe in with that one, because I can't, while I'm trying to facilitate the call, I can't get online to a website to verify that, but I can certainly get back to you, and I can see that's you, Brenda. Okay. And then Eric says, I want to make sure we're clear on the contraceptive mandate. Iowa law was not impacted by the Supreme Court decision, so fully insured in Iowa is still required, not covered at 100%. ACA mandates the 100% coverage and still is active unless a company files for the exemption under the religious freedom. However, in Iowa, we still mandate contraceptive coverage, so the Supreme Court would have to overturn Iowa law in the fully insured market to impact this in Iowa, clear as mud. Well, thanks for that, Eric. I think it still goes back to who's paying for it. And so, yeah, more to come on that, I'm sure. As I said earlier, the lawsuits are coming because this now, freedom of the religious freedom in our country, and I'll tell you, there's so many other angles. I heard another one on the radio as I was driving to Fort Dodge this morning. So, yeah, like you said, clear as mud. I think the key there is that when you're talking to that employer group, if you know them like you should know them, and they've been your client, and you understand their convictions, then this is something that you'll want to dive a little bit deeper into. And I think especially as it relates to any kind of conflict in Iowa. So must be offered, but certainly not paid for. But I think there's also certain types of what I'll call contraceptive coverage that's more offensive to some than others. So yeah, oh boy, yeah. All right, any other? Looks like I've got through the questions there. Let me see if I've got any more questions or comments. Not yet, but let me see if I've got any more hands raised. This is good stuff, you guys. Good questions, good comments. Okay, I'm not seeing anything else there. I will take this time just for a moment, too, to share an upcoming webinar that we want to host. And I'm trying to be sensitive about everybody's schedules and timing, and there's so many meetings coming up right now. But for those of you, I've been kind of talking to a few of you about your need on your large group cases. And when I say large group now, I'm really referring to the 51 plus. Because in this market, this is where, of course, the employer mandate hits. This is where shared responsibility. And even though the 50 to 99 are not required right now to have to offer coverage, which means also they don't have to fill out the forms, that won't hit them until 2016. The question comes up is, who are you or how are you helping your clients complete those forms, their shared responsibility forms? And we talked about that just a little bit earlier in the presentation, where they finally got out some of these draft forms that will need to be completed. And when you think about it now, the forms will be completed, from what I've read, in 2016, looking back on 2015. But we need to know what those forms are and have a plan in place so that our employers, our employer groups, know how to complete the forms. So I talked to one agent who said, yeah, I do that for them. And so a big concern that I would have is certainly around compliance, because really then if we as agents are standing in and completing those forms, or we're offering to do that, then we're going to carry that burden of maintaining compliance for that group. So so I found that interesting, and that's wonderful if you've got the expertise and you've got the certainly the E&O coverage and the compliance guidance and whatnot to help your groups do that, rather. And so the other option that you have is to help them find a firm that will help them, and then you get into their payroll systems. And so the comments I want to make is that we've had some conversations and are entering into a really nice partnership with ADP for you guys, offering you 20% discount on their rates, offering you to be able to offer to your clients. There's also, it's not a lot, but there's a little bit of revenue sharing there, if you want to call it like a referral sharing there if you refer a client. So ADP is looking at obviously being able to do these reports, keep your clients in compliance. And that's, I think, what I want to stress. So if they're looking to you and thinking that you're going to do this and help them complete their forms to the government, and you're not, your intention is not to do that, then how are you helping them find a place that will do that for them? So you'll hear more about this, and maybe you've already done a lot of your own research and you're going to take it another direction, and that's fine. The thing I do like about ADP is they can do what I'll call all three of the components of collecting the time cards, right, and the time, however that's done in a company, and processing payroll, and then from that information being able to generate those reports. Keep your client compliant. Keep your client compliant. So anyway, so we're going to be talking to you a little bit more about that. And that, again, is what's most important now are the 101 plus, or 100 plus rather, and then going forward it'll be down to 51 plus, right? So anyway, just know that we're going to be offering an option for you guys to use that if you have a need for that, unless you found something else or your client found something else. But again, it's hopefully showing you guys your value and helping them to you can show them, here's the formula or here's the form, but who's actually going to complete it? And I think from the feedback I'm getting and the reading I've done, there is just going to be a lot to it. So anyway, let's see. And then Eric said 2015 penalty is plan year. Thank you. So what that means, to answer the prior question, right, is that they need to convert over sometime in 2015. So if they've got a 4/1 of 2014 effective date, right, and they renew 4/1 of 2015, then that would be when they would move over to the new plans, right? And then another comment here from Carol Weber says, choosing a new broker for Wellmark, is this August the only time you can choose, or will that be an annual thing? And that's a great question. And what we are understanding right now, that in the entire marketplace, that Wellmark intends to allow this to be an annual event, to where agents will be able to move their block of Wellmark business once a year. They haven't given us the dates for that yet, but we anticipate that will be true. Yeah, so, and I guess this is opportunity. I want to make sure you guys are all aware of this. Most of you are on the call because you're currently contracted with KHI for some product, and not maybe all your products, but some products. And I just want to say this, that KHI just has the belief that, that we are here to earn your business each and every day. And so if for some reason it doesn't work out for you here at KHI and you are not getting what you need, A, I hope you would tell us, but B, if you have and for some reason it's not working out and you want to leave us, we will release you first of the month following notification. And so for us, any carrier, anytime, we would release you. So if you did choose KHI, just know that it's a choice that you would make, and that if it didn't work out for some reason, you are not handcuffed to us. We just don't believe in doing business that way. We believe in making sure that we're providing the best that we can to you every day. And if we're not, then you have the right to go wherever else you need to go to get your business taken care of. So just know that it's actually in our agent contracting. So if you don't have your Wellmark with us today and you're interested in looking at us, please just get a hold of me, or you can actually email Nicole or tell me, and I'll have Nicole email you the paperwork. It does need to be submitted for Wellmark by September 2nd. So, but yes, I think I answered that question and probably a little bit more. But we just thank you for all of you that do business with KHI, with whatever carriers you do business. And of course, we'd love to earn more of your business. That's our job, and help you with all things. It does have some economies of scale when you're dealing with one general agency, I think, for as many products as you can. And yet we appreciate some people don't want to put all their eggs in one basket, but I do want you to know that if you did choose KHI for any of your carriers and you, at any time you wanted to take them somewhere else, that we would release you. No questions asked. You just let us know. Okay, and then thanks Eric, for just kind of double checking and finding your reference on there. Thank you. Let me see if I've got any other raised hands. Thanks for the questions, you guys. That does work out so well. So we keep on track here and kind of keep the background noise down. Doesn't look like I have any other questions on the hand raising, and I'll just check my typed in questions here again. I'm not really seeing anything else. Okay, so while we're just wrapping up here, I'm going to throw something else out. We just started this really cool testimonial program with this really cool gal that will send her camera around to do testimonials. And so I said, well, let's try it. And so we tried one, and she went out, and she was actually in Des Moines, and so she went to one of our Des Moines agents and got a testimonial, video testimonial, about how they feel about doing business with KHI. And so we're going to put that up on our website. And so I would ask you guys two things while I've got your ear. If you have any interest, or would have any interest in sharing a video testimonial with KHI based on the service and the support that you've received from us. If you're in a remote area, not in Des Moines where our little camera person is, what she does is she ships the camera, and then you do it yourself, and then just ship it back, and we'll figure out how to cover shipping. I don't want this to be an expense on you. We'll take care of that. But I found that interesting, and then she'll do the editing, and then I look at it and approve it, and we put it out on our site. So if you're interested and you're willing to do that, please send me an email and say, yeah, send me the camera, I'll do it. Or if you're in the Des Moines area where our camera person is, she'll come see you. Then let me take it a step further. And this was very interesting because the agent that she went and videotaped earlier this week said, I think I want to use you. She's really great. She's really reasonable. And think about you trying to expand your business, and why not get some of your clients to do testimonials and put them on your website. Now, maybe many of you are doing it, and it's not a new idea, obviously, but it is sometimes just hard trying to figure out who's going to do it and who can coordinate this for me. She is making this so painless for us, and that's the key, and it's so reasonable. So like you can get a package of 10 video testimonials used within a certain period of time, and I don't have all the detail right in front of me. If you're interested, shoot me an email. I'll get you her contact information. Just talk to her. There's nothing in it for me other than she's just a great gal, and we're going to work with her. But like you can get 10 video testimonials recorded and edited and sent to you on a stick for like $2,500 bucks. And I think that's really reasonable. And so now I'm sure if she has to travel around and spend more time actually, doing it herself, but I don't know. It's worth talking to her anyway and seeing what your unique situation is. But it is all about, people, and I'm finding this. You guys maybe want to listen to things rather than read things. So would somebody listen to a testimonial? Think about your social media and how you guys, if you get on LinkedIn or especially Facebook, do you read it, or do you click on the video? And do you watch the video? And she knows you don't want them very long because people stop listening. But how powerful is a video? Or why not have her record you, introduce your company, and maybe a little bit about your value proposition, and then put that on your website. So she'll do 10 videos of anything. It could be if you've got more than one person in your office, it could be a team, and maybe you do one for a Christmas video that you're going to send out or put on your website for the holidays or something like that. So anyway, I just throw that out to let you know that these are the kinds of things I want to bring to you guys as we look at things and find some good deals out there and good people to work with. Let us know if you're interested, and I'll get to that. And there's, like I said, nothing in it for us other than just helping you guys promote your business. We think we got a good one in this gal. So, well, everybody, I don't see any other questions are coming in. I don't see at this time any other hands raised. If I've missed you, I apologize. Shoot me an email. But thanks so much again for your support of KHI and for your participation this morning. And we're always open to your feedback. If there's ways we can improve, please let us know. Lynn at KHI Solutions, I think you all have my email address and phone number, 515-570-8811. I'm on the road a lot, talking to a lot of folks right now, so give me a holler. And one quick update here just came in from Eric, and it looks like he's got a little IRS question and answers on employer shared responsibility provisions under the Affordable Care Act. It references for the non-calendar year plans in 2015. So why don't I will put that link on the PowerPoint slide. That will be loaded out onto our website. It won't be, of course, part of the video that we put out there too, but we always put the slides out there. So I'll add that to our slides, and usually Nicole gets that posted out to our website usually a day after we have the call. It just takes a little time for it to download. So look for that information tomorrow, and/or if you need it sooner than later, let me know and I'll email it over to you. All right, thanks again, everybody. Have a great day, and we'll be in touch soon. Take care. Bye-bye.